My name is Niravath. I'm a breast medical oncologist here at Houston Methodist Hospital. Breast cancer is the most common cancer for women in this country as well as globally. So unfortunately, that leads to a high number of breast cancer deaths. Globally, it's almost 700,000 deaths per year, and in the United States, it's over 40,000 women who die of breast cancer every year. Thankfully, we have many clinical trials going on all over the nation. Here at Houston Methodist, we have dozens of clinical trials across all the different cancer types. Clinical trials are really the only way that the science and the treatment can actually move forward. Clinical trials are the vast majority of the reason why our cancer treatment has gotten so much better over the past decades. So many times when patients think about clinical trials, sometimes they have the conception that they're being experimented upon, but that couldn't be further from the truth. Clinical trials are actually very standard, and it's the only way that new drugs can come to market. Some people think that, well, I don't want to go on a trial because I might be getting a placebo, for example, but that's really never going to happen if you have a life-threatening problem like cancer. So, for example, in cancer clinical trials, patients are typically randomized to either a standard of care arm, where you would get the same treatment that you might get anyway, even if you were not participating in the clinical trial, versus possibly being randomized to the experimental arm, which typically has been examined before and felt to be likely very safe and effective. And they're comparing and monitoring these arms the whole time. There's actually interim analyses that happen partway through the trial, so that if it's found that one arm is clearly superior over the other one, the trial will sometimes even be closed prematurely and everybody's moved over to the superior arm. So all the clinical trials were always conducted with the welfare of the patient in mind. Here at Houston Methodist at the Breast Center, we're very excited to have a trial here. It's a phase 2 trial. We call it the DTP trial, standing for durvalumab, trastuzumab, and pertuzumab, which is a mouthful, which you can see why we call it DTP. This is a very exciting trial. It's meant specifically for patients who have HER2 positive early stage cancer. This comprises about 15 to 20% of all breast cancer patients. Historically, the standard treatment for HER2 positive breast cancer is the combination of chemotherapy and what we call smart drugs, or targeted antibodies that specifically fight this HER2 portion of the cancer that's present in 15 to 20% of cancer patients. So what this trial is doing is actually very novel. It's looking at de-escalating the therapy, meaning that we realize that patients who have this particular type of cancer tend to do so well that we can sometimes even omit the chemotherapy entirely and depend entirely on these smart drugs or these targeted antibodies to fight the cancer. And it can actually be as effective or sometimes more effective and less toxic than giving chemotherapy. So this trial, everybody on the trial has to qualify, obviously, meaning they have to have HER2 positive breast cancer and estrogen negative breast cancer, meaning that the HER2 molecule is the main driver of the cancer, and estrogen and progesterone are not drivers of that cancer. These are the ones that are the most likely to respond to just the targeted therapy. And then furthermore, we actually do a genomic analysis on these cancers to find out the patients that harbor the tumors, which are the most likely to respond to just targeted therapy alone without chemotherapy. So once we do this initial screening to find out which patients are the most likely to respond, if we find out that they're eligible, then they receive 6 cycles of this specified treatment, which is durvalumab, which is an immunotherapy, in combination with the monoclonal antibodies trastuzumab and pertuzumab, also known as Herceptin and Perjeta. The wonderful thing about this trial is that it's a very non-toxic treatment. Because patients are not getting chemotherapy, it means that they're not losing their hair, they're not having nausea and vomiting. In general, they feel very good. They don't have higher risk of infection, and they can continue to live their life more or less normally, for the most part, with a very good quality of life, as opposed to the standard of care, which might be a little bit of overtreatment possibly, with a lot of chemotherapy. So for the appropriate patient, they can potentially get a treatment that is far less toxic and much more tailored to their specific type of therapy. The very exciting thing about these results so far is that we're seeing a very high rate, up to 70% of patients who are getting a pathologic complete response, meaning that with just these targeted drugs, when we're going to the time of surgery, all of the cancer in the breast has been killed, which is fantastic. So these patients then go on to receive just these same targeted therapies after the surgery to finish out 1 year, which is the standard period of time that we treat HER2 positive breast cancer. So that means that these patients are going on to never receive chemotherapy, and those that received the pathologic complete response are very likely to be cured. We know that those patients are very unlikely to ever have cancer recurrence. And I will note that for the minority of patients who don't achieve a complete response, where if they still have some cancer remaining, then they are switched over to receive standard chemotherapy. So those patients are still given every chance to get as good of a response as they can, and ultimately the best outcome. The very novel part of this trial is the combination of these drugs, which have really not been used together before, but have been found to be very active in smaller clinical trials. So specifically, the trastuzumab and pertuzumab, these are used in standard care for HER2 positive breast cancer. And these are monoclonal antibodies which are actually trained to find this HER2 protein that sits on the outside of breast cancer cells and very effectively kill those cancer cells. Now, the interesting thing is that we're combining it with an immunotherapy, which is then revving up the patient's own immune system and helping them identify these foreign cells that contain HER2, and then it increases the ability to kill those cancer cells by using these two in combination. When HER2 positive breast cancer was first discovered, it was felt to be a very poor prognostic factor, meaning that people who had HER2 positive breast cancer were unfortunately much more likely to die of their breast cancer, more likely to have metastatic spread, and much more likely, unfortunately, to have brain metastases as well. And we did not have good treatments for this cancer. We were actually just using the same chemotherapies that we used for many other types of cancer. This completely turned on its head when the monoclonal antibodies were discovered. So now that we have these targeted therapies, which actually specifically find and eradicate these HER2 positive cancer cells, the outcomes have actually become some of the most favorable that we have in all of breast cancer, and even within cancer in its entirety. So we now have patients who come in with very advanced disease that's HER2 positive, and we're able to actually cure them at extremely high rates, up to 75 to 80%, by using these monoclonal antibodies and chemotherapy. The very exciting future for this is that if this early phase 2 trial proves to be effective, then it very well may change the entire paradigm of how we treat HER2 positive breast cancer. Meaning that currently everyone that has HER2 positive breast cancer is treated with chemotherapy, Herceptin, and pertuzumab. Whereas if this trial is found to be positive, then we can actually find that subset of HER2 positive breast cancer patients who may not need chemotherapy at all. So these patients would be treated and most likely cured without ever having to receive toxic chemo.